I'm Dr. Dave Jand, and welcome back to Operation Freedom Briefings. The goal of this briefing and my weekly radio show, Operation Freedom, which airs on Wham Talk 1600, based in the People's Republic of Ann Arbor, every Sunday from 2 to 5 Eastern, is to provide you information the bought-off, lamestream fake media will never provide. Today's topic in particular is going to focus on Obamacare. There's a lot of talk. Well, should we modify it? Should we repeal it? The answer is, in a nutshell, Obamacare can be considered cancer. It's a cancer that will adversely affect every person, every family, and every business in our country. I came to that conclusion many years ago, as far back as 2009. Now you might be saying, wait a minute, Obamacare really didn't pass till March of 2010. No, here is what you haven't been told. Obamacare is two, not one, two parts. The second part of Obamacare, the health care bill, was passed into law in March of 2010. But what you haven't been told is the first part of Obamacare was actually hidden in the stimulus bill in February of 2009. And in fact, that's how I got on the bad side, if you will, of the Obama administration's radar screen, because I was one of the few folks that pointed this out. And let me tell you how we know half of Obamacare was hidden in the stimulus bill. Because we read it. As opposed to Pelosi and folks in Congress who said we have to pass it before we know what's in it, frankly, that's like trying to do an operation without knowing any anatomy. No. We dissected the stimulus bill, and hidden in the stimulus bill were actually two boards, one of which was called the Federal Coordinating Council for Comparative Effectiveness Research. That's a rationing board. How do we know that? The definition of comparative effectiveness is the approval or denial of a test or a procedure based on two things: the cost of the treatment or test, and two, the number of years the patient will benefit from that test or that treatment. In other words, a rationing formula based on cost and the person's age. The second entity that was developed and put forward in the stimulus bill was the National Coordinator for Health Information Technology. Now, that doesn't sound bad. I mean, if you're any kind of tech-savvy person, you get, how could that be bad? Well, it states in the stimulus bill that the National Coordinator's Office will, quote, guide medical decisions at the time and place of care. Whoa! And we also found in the stimulus bill that this organization, this coordinator, will be responsible for monitoring treatments to ensure providers, like myself at the time, and hospitals are following government protocols. It went on to say that the hospitals and providers that are not meaningful users of the new system will face penalties, and the Secretary of Health and Human Services can impose more stringent measures of meaningful use over time. Well, what does all that gobbledygook, what does that mean? Well, I was asked in July of 2009, after the stimulus bill had passed in February 2009, to present to one of the House committees at a congressional dinner in the Capitol building. And it was the Minority Committee on Policy. And when I showed these entities that had already been passed into law to these congressmen and said, what does this mean about these stringent measures and these penalties? I was told, look, Dr. Janet, if you don't go along with it, at your first offense, you could be fined. After the protocols that were developed by the Federal Coordinating Council went into effect. And after one or two times that you didn't follow the protocol that the government mandated, that you as a provider could face increasing fines, and to the point, one congressman said you could even face jail time. Jail time for taking care of a patient. Not the way the government wanted, but the way you were trained to, a high-quality care delivery. So at the end of my presentation to these congressional members, I was asked, what's the one word to describe Obamacare? My mom was a history teacher. She taught me many different, if you will, systems. But one system she taught me was something based on authoritarian nationalism that penalizes and punishes anyone and everyone who opposes the state Well, all I have to do is look at those penalties that were outlined in the stimulus bill, and it became very obvious. I looked at this congressman and said, the one word, Congressman, to describe what Obamacare is about is fascism. I know that sounds really strong and overplayed, but it is. Patients that don't sign up get penalized and get visited by the IRS. Providers that don't go along with these protocols can face penalties as outlined in the stimulus bill. So don't let anyone kid you. When anyone asks you, in a nutshell, what Obamacare is about, what I say, Obamacare is cancer that will adversely affect every person, family, and business because it's based on the most unethical means of cutting costs, that's rationing and denying of care. And two, it's a penalty-based system that really, if you will, its foundation is fascist. You can stream and hear more about these topics, in particular Obamacare, on my show, Operation Freedom. It's on every Sunday, 2 to 5 Eastern. You can stream it at davejanda.com or whamradio.com. You can get the podcast. We always have them available up at Sunday night at davejanda.com. Until next time, this is Dave Janda signing off. Dream big and dare to fail.